Hello, my name is Vanni Peng. I'm working for GIZ Improving Social Protection in Cambodia. I'm going to share with you one component of our work focusing on improving health professional education in Cambodia. The health workforce situation in Cambodia is similar to other countries in terms of shortage number and also staff lack of competency, and there are issue of proper planning and also distribution. That's why the education training system is also still limited. Ministry of Health has set a long-term goal, which is expecting to produce new graduated health professional to meet international standard, at least within Asian standard in our neighbor country. And Ministry decided to implement Preservice education reform. The GIZ project we focusing on support implementation of competency-based education in line with the Ministry of Health standard, and we focusing on 2 out of the 6 professions, which is medicine and medical lab technology training. So our work, we work with one training institution and also a clinical practice hospital, and we focusing on 5 dimension of competency-based education. I'm going to share with you one by one in the following slide. The first one, we focusing on our work on improving learning management system. We look at the analysis and support hardware, and also we develop software we call a Moodle system that can enable student digital teaching. And number 2, we focusing on improving teaching and learning methodology. So we improve capacity of faculty staff. We look at improvement of their learning, training material as well as pedagogy and methodology training. At the clinical practice side, we work with clinical preceptor and the hospital to make sure that there's a linkage between preceptor and student, and they can provide constructive and effective feedback to support student learning and also make sure they can practice a skill. Number 4, we look at the student engagement, just to make sure that students they can provide feedback about their learning and their participation, and also join some networking activity in the institute. And number 5, we look on focusing on the student assessment. So there are different methods. We focusing on the supporting of formative and summative assessment, and how to link with digital life for the student assessment. The institutional improvement part, we focusing on quality improvement. So the project bring in an approach we call appreciative inquiry approach, which is a new an approach that more encouragement and also encourage faculty staff to continue internal quality improvement. Specific example like the improvement of learning management system, the project can bring in the development of Moodle, and then faculty staff themselves, they can contribute and invest in supporting hardware in order to improve the digital learning. And the project also contribute to improve some infrastructure and also basic equipment in order to support student practicing, especially for medical laboratory training. The results so far, the learning management system have been introduced, and faculty staff and students enjoy using it, and students can access to the system. They can learn from distance, and also faculty staff continue to upload their training material into the system. And for the clinical practice side, also clinical instructor, they provide gradually support to students, and they do direct observation and also more constructive in support student better learning. There are some challenges so far that we lack of a standard and also policy from Ministry of Health during the reform, and also there's also limit collaboration between the health training institution and the hospital itself, because they are not the same compound. And the challenge number 2, we also see that the applying and use the LMS application, some faculty staff and students, they are not familiar with the system and high technology, and also it takes also some time in order to change behavior of teaching methodology. And number 3, we look that the system itself overall doesn't motivate and support the implementation of competency-based education. And also the student need to make more effort in all the learning as well, because they need to read material before they come to the class. And these are some remaining tasks that we see. We need to reinforce the implementation of LMS, maybe the development of policy and use it, and also how to make sure that individual student can access to laptop, maybe some idea of a student loan, etc. And another, we will continue capacity building to lecturer, and also create environment how to can support student learning. I think many experience in other places about small group learning, and also a senior student provide support and teach their junior one. And another task that we see a possibility of our project can contribute to national and policy development, and also how to make sure that there's strong collaboration between health training institution and the hospital, because the situation in our country, we don't have teaching hospitals. Now it's come to the end of my presentation. Thank you for your attention. If you have any question, we can discuss.